Hello friends, if you find complete denture difficult to understand, then this video is for you. In 10 minutes, I will try to explain the basics of this topic. Now, often you must have seen such patients walking into the operatory or in a general areas where you must have seen edentulous patients like your grandfather, grandmother who will be having edentulous jaws, that is, which are having missing teeth in either both the arches or in one arch. Now, the best way and the simplest way to rehabilitate such patient is by fabricating a complete dentures. So, what is a complete denture? Complete denture, by definition, is a removable dental process that replaces the entire dentition and associated structures of the maxilla or the mandible. If you take an OPG of this edentulous patient, that is the orthopantonogram of this patient, then you find that there is no teeth in either the upper arch or the lower arch. So what are the indications for complete dentures? So it is given in patients who have lost all the teeth in either both the jaws or in one jaw. The objective of the treatment is it helps the patient to chew food for adequate nutrition, restores aesthetics by preserving the normal appearance, restores speech, provides patient comfort and well-being. So what are the clinical steps in complete dentures? There are 5 steps in fabrication of complete dentures and there are 5 clinical steps. Step 1 is the primary impression. So what are primary impressions? Primary impressions are made to record the soft and hard tissues of edentulous jaw for the purpose of diagnosis, treatment planning or fabrication of custom trays. So whenever we are making primary impression, we use stock trays. And the most common impression material which we use for making primary impression is the impression compound. That is a rigid thermoplastic material and it is also reversible. Apart from this, you can use irreversible hydrocolloid or alginate, and we now no more use impression plaster. So then once we have taken the impressions, you fabricate a custom tray with the spacer design in it, and after this you are ready for the next clinical step, that is to make a secondary impression or the final impression, also called as the wash impression. Now this impression is made after doing water molding of the upper and lower arches. It is made by using a custom tray. This is a custom tray or a special tray, and its primary purpose is to record the denture bearing areas as well as the muscular peripheral tissues in function. So in border molding, it is basically the shaping of the border areas of the impression material by functional or manual manipulation of the soft tissues. Border molding can be done in either 2 techniques. It could be a multi-step technique, also called a sectional or incremental technique, or a single step border molding. Now, the material of choice for multi-step border molding is green stick compound, and the material of choice for single step border molding is polyvinyl siloxane, or also we can use polyether. The material of choice for making final impression is low viscosity impression material, that is zinc oxide eugenol impression paste, which you can see here, and you can also use medium body elastomeric impression materials. This secondary impression, as I have mentioned to you earlier, is also called as wash impression because there is a thin film of material which exists between the properly molded molars, borders and the peripheral tissues. Next laboratory step is on the basis of once you pour with gypsum, the final impression, you get the master cast, and on the master cast you fabricate the record bases and fabricate the occlusal rims. Now once you have fabricated the occlusal rims, you move to the step number 3, that is recording of the jaw relations. So primary jaw relations are established spatial relationship between the upper and the lower jaws, which are essential to ensure functional and aesthetic dentures. The types of jaw relations are vertical jaw relations, you have centric or horizontal jaw relation, and the orientation jaw relation. Now what are these? Vertical jaw relation, in this type of jaw relation, we record the vertical dimension at rest, vertical dimension of occlusion, and the difference between the two is the freeway space. So vertical dimension of rest is the postural position of the mandible with minimal muscle activity, and vertical dimension of occlusion is when the teeth or the occlusion rims are in contact, like you can see here. And the difference between the rest position and in occlusion will give you the freeway space, which is generally 2 to 4 millimeters, which is required. Next is the horizontal jaw relation. Now, in horizontal jaw relation, it is the anterior, posterior and the lateral position of the mandible related to the maxilla. Here, centric relation, we record centric relation, which is a repeatable, recordable and a learnable position, which remains constant throughout life. And why this relationship is very important? Because this is a bone-to-bone relationship. Apart from this, you also record the eccentric relation, that is a position other than the centric in the form of protrusive and lateral records. Next is the orientation jaw relation. It is a spatial relationship of the maxilla to the cranium, that is the skull base, and it is recorded with the help of face book to accurately position the maxillary cast onto the articulator. Like this, if you see, you position the maxillary cast onto the articulator. Next laboratory step is to do the teeth arrangement. That is, at the time of jaw relation, you also select the teeth and then you arrange the teeth on an articulator after mounting the cast on the articulator. Next clinical step is the wax trying. It is the process of placing a trial denture in the patient's mouth for evaluation. Now, what do you evaluate during the trying? That is, you check the relationship of the maxillary teeth with the mandibular teeth. You verify the intraocclusal distance. You verify the jaw relation records. You evaluate the fit and extension of the denture. And you also check the overextension or underextension of the trial denture. And you check the occlusal plane, whether the occlusal plane is correct or not. You verify the aesthetics and the phonetics of the patient. Also, in this stage, it is very important to record the postopalatal seal area. So the laboratory step after this is denture fabrication, and you fabricate the dentures using the compression molding technique. Next step is the denture insertion. Now, in denture insertion, it is a process of directing the processes to the desired location. That is, you for the first time, you try the dentures in the patient's mouth. The objective here is very simple. Before inserting the denture in the patient's mouth, you have to identify and check and evaluate under good light that if there is any blebs, acrylic blebs or roughness or undercut on the impression surface of the denture. What is the impression surface? This is the occlusal surface, and behind this is the impression surface of the denture, which may cause soreness. So you have to relieve those areas so that it does not hurt the patient. Next is identify and correct any interference with retention and stability, and also you correct the occlusal interference. For that, you may be needing to do the clinical remount procedure, and you will be relieving the occlusal interferences by using selective grinding method. Next is to deliver the dentures to the patient after giving proper post-insertion instructions. And what instructions you will give to the patients? That when you are wearing the denture for the first time, you will feel the dentures are slightly loose. It will be difficult to speak. There will be more saliva forming. So it will take time for adaptation. It may also so happen that the dentures may hurt. So immediately you will tell the patient to come for a follow-up after 24 hours. That is very important. And thereafter you will be calling the patient after you will be giving a weekly appointment for a couple of weeks so that the patient is comfortable with the processes. Maintenance protocol, you will be asking the patient to keep these dentures during the night after cleaning them in a bowl of water so that the dentures do not distort or warp. And also the patient has to rinse after every meals, and he have to maintain the dentures and clean it with brush and liquid soap or alternative methods. What are the most common mistakes when we are fabricating the complete denture? One, it could be a faulty impression that could result in poor retention of the dentures. There could be increased vertical dimension that may lead to clicking sound when the teeth meet each other. There will be strained facial expression, and there will be inability to close the lips. If there is a reduced vertical dimension, that may lead to sunken facial appearance. There would be creases at the corners of the mouth, and there would be reduced masticatory efficiency of the patient. If there is improper tooth positioning, the patient will definitely have speech problems. If there is occlusal error, then as the patient bite on chewing the food, there will be shifting of the denture on biting. And if there is an incorrect overjet or overbite, there will be tendency of cheek biting or tongue biting. The dentures are overextended, there will be an disgorgement, and it may so happen that if the buccal flange is overbulked, then there will be chances of lifting of the maxillary denture. So you have to make sure that you don't make such mistakes, and then only you can give a proper fabricated dentures. Please like, share and subscribe to our channel. Thank you for watching the video.